Our lovely patient, who's 62 years old, is about a year out from her brachioplasty, which is also known as an arm lift. And she's here in follow-up, and she's very graciously agreed to share some of her thoughts and feelings about what she was hoping to achieve and how she feels about her results.
Well, what I was hoping to achieve was smaller arms for sure. I really was struggling with my arms being really, really flabby and a lot of extra skin. And I really struggled with clothing, fitting right because of my arms. And so that was the aim, to get my arms to a size and that I was comfortable with, and that looked good in my clothes. And I think I've achieved that.
That's awesome. That's awesome. Now, when we did the operation, we did it in our Quad ASF surgical facility under what we call tumescent local anesthesia, which translates to the procedure being done with you awake and chatting with us. How did you feel that whole experience was like for you?
Surreal. It's more like, I obviously didn't feel anything because it was kind of because I was sedated. So I just felt, it just feels surreal. Yeah. I don't remember a lot. I just remember that it took a little bit of time. And afterwards, there was a lot of fluid, but other than that, I didn't feel a lot of discomfort afterwards until later on.
Yeah. And we don't use drains. Did you find that aspect of it appealing?
I don't know. Because this was my first time having any kind of plastic surgery, whatever, cosmetic surgery procedure. So I didn't really know what to expect. And there was a lot of fluids afterwards. But then once I got home and did the bandaging and all of that, after about a couple of days, everything was fine. So I didn't really know what the procedure would be like. I really didn't know what to expect. So it was a lot better than I thought it was going to be.
That's excellent. And that's our general experience that patients have. Tell us a little bit about how you found your way to come to see us. You were saying that you searched Google as well as you'd been given a referral from one of your dermatologists.
Mm-hmm. Yeah. I did some research, and then the dermatologist gave me a couple of names, and then I researched some more. And so Bryn Mawr was easy to get to, and I looked at some of the testimonials online for your practice, and so I decided to go with this practice, and so that's how I ended up here.
Perfect. A lot of patients ask, is this something that you would recommend to a friend?
It all depends on what people want. It's not going to be an easy recovery, so people you have to be a little bit more realistic. I think for me, I wanted a certain outcome, and I got the outcome in terms of the look of my arm and the size of my arms. I don't think I was as prepared for the scar as much. And so that took me a little bit getting used to. But now that it's fading more, I'm feeling a lot more comfortable with it.
Good. Well, thank you so much for sharing.
Thank you.